Hi everyone and welcome back to Off the Cuff with me, your host Kaylin. So today we're going to be talking about the medical field, vaginal health, and a personal story of mine. And the disclaimer today is that everyone's experience with physicians will vary. Some of you will have great experiences, some of you will have not so great experiences, and some of you may be somewhere in the middle of that. Since I started going to OBGYNs, I have so far been through 5 OBGYNs, 2 nurse practitioners, and 1 midwife. Out of the 5 OBGYNs that I've seen, 2 of them have been really good. The one that was really good was my old OB provider. She actually recently just got fired as my doctor. I decided to no longer work with her. And my other one, my new OBGYN, I had just seen yesterday for the first time, and I love her, and I'm excited that I made the switch. Out of the 2 nurse practitioners that I've seen in my life, one of them has been really great. The other one, I don't really have any remarks to say. And 1 midwife, and that experience was terrible, and I'll actually be talking about that story today. So, even in the most likely of settings, with your partner, with your medical provider, sometimes people still aren't willing to talk about what's going on if they're experiencing sexual dysfunction or painful intercourse. A lot of reasons go into that. You could have told, a close friend or a family member and they couldn't relate, being embarrassed about it. And I'm here to reassure you it's nothing to be embarrassed about. And I have heard of people, my physical therapist once told me that she had a patient or knew someone that would have sex with their husband with the lights off because she didn't want her husband to see her cry. No one deserves that, and no one should feel trapped enough to have to do that. There is help out there, and there are physicians that care. Finding the right one can be hard. And on average, my physical therapist told me, is when a male experiences some type of sexual dysfunction, on average it takes him 3 days to go seek treatment. For women, on the other hand, and I'm sorry this isn't like inclusive language, it's just what she told me, on average for women to get help when they deal with sexual dysfunction is 7 years. So there's that. So the medical field plays a big role within an already complicated disorder, and not being believed by a physician can be exhausting, emotional, draining. A lot of them tend to gaslight you, and what that means is that they try to alter your perception, to twist it so that they essentially don't have to do more. Actually, I have a photo in here. What is gaslighting? When someone intentionally twists your perception of reality for their own gain. And you might say, well, what's in it for the physician to twist things? And it's to do less work, to not have to deal with the situation head on. And I didn't know if it was my own reality, if maybe I was just having really bad luck running into physicians that just weren't paying attention or didn't understand what I was saying or was mean or didn't care. And in college, I actually did a paper that I was able to explore sexual dysfunction and the inequalities between men and women when it comes to seeking help. At the time, I couldn't use inclusive language, so that's why we have broken it up. But in a study done by Gott in 2004, it's quoted, quote, "Sexual health management tends to focus on the prevention and management of sexually transmitted infections, also known as STIs, providing contraceptive advice, and performing smear tests. Sexual dysfunction received very low priority," end quote. I think that the very low priority was putting it nicely, because it's not every day that you go into your physician and let's say you're married. They don't typically ask, are you enjoying sex? It's just not a question that comes up, but it should. So I kind of wanted to segue into talking about 2 of the most common vaginal infections. Vaginal infections are very common. They're very easy to get. They can be uncomfortable, but they're not gross in a sense that society has made it, and they can clear up pretty easily. So the two that I'm going to talk about today is your yeast infections and bacterial vaginosis. So let's talk about yeast infections first, because I feel like we hear about that the most. So yeast infections are an overgrowth of candida, I think I'm saying it right, which is yeast. And that's already in your vagina, but most of the time at low levels where it's healthy. What causes yeast infections? Sometimes your diet, antibiotic use, if there's an imbalance. And there are about 200,000 cases per year in the United States. There are a couple ways that you can treat it. You can buy over-the-counter antifungal creams. They have a 1-day, a 3-day, and a 7-day. All my OBGYNs that I've seen have always recommended the 3-day. For individuals who are still dealing with sexual dysfunction or unable to put things up there, because you will have to put something up there to use the cream, you can get a pill called fluconazole, which I actually have one right here. It's just a pink little pill. No, you cannot get these over the counter. You have to have a prescription. I did have a prescription for this. I didn't need it. I didn't end up having a yeast infection. They prescribed it before I got the result, just in case if it did come back positive, I had that. But I did not at that time. The second vaginal infection is bacterial vaginosis, and that is actually the most common vaginal infection that we can get. And it's just an imbalance of bacteria within the vagina that's already typically there, but just at unhealthy levels. And bacterial vaginosis is caused by activities that change the balance of the bacteria in the vagina. So intercourse, frequent douching, using scented soaps or any type of fragrances, and this is very common. There's about 3 million cases per year, and the symptoms for that is you can have a gray vaginal discharge, you can have mid-cycle spotting, you can be completely asymptomatic, sometimes there's a foul odor with it, but again, sometimes you have no symptoms at all. Versus yeast infections, which you tend to have a thicker cervical mucus and there's a lot of itching. With bacterial vaginosis, there's not a lot of itching going on. So the itch is a pretty good indicator of, what infection you may have if you're going through that, but it's always best to obviously go get a professional opinion. So a normal vaginal pH is between a 3.8 to 4.5 on the pH scale. And these numbers keep the bacterial and fungal infections at bay. So when you're in that healthy spot, no infections tend to happen. Semen is at a 7 pH on the pH scale. Now, you might think, how are you ever supposed to conceive or anything like that without getting an infection? And I actually learned that egg white cervical mucus, the mucus that you tend to have, the cervical mucus you tend to have around ovulation, also is at a 7 for a very limited time, so that conception may be possible. But then you'll go back into that normal 3.8 to 4.5 range. So I told you there was going to be a personal story today. So I'm going to tell you the story of the midwife that I saw. So it was back in December of 2017. I was not sexually active yet, and I was experiencing some itching, and a little bit of thicker cervical mucus than what I was used to. And obviously I knew I would not be able to successfully undergo an exam to get a vaginal swab. But I wasn't finding any relief, so I did have to make the appointment. I knew at the time I wasn't going back to see my old OBGYN, so I made an appointment with this midwife. So it was December of 2017, Cody came with me, and her and I sat down and I explained, I wouldn't be able to endure an exam because I don't know at the time if I knew that I had a word of vaginismus. I don't know, but I told her that I wouldn't be able to endure it. I couldn't even have intercourse at the time. So she was like, well, how am I supposed to check you? And I didn't know. And she was like, well, let's try an exam, which of course I knew it wasn't going to work. So she got the speculum, and right before she went down, she popped up and she's like, you're quite small. Do you have an eating disorder? I was pretty dumbfounded. I was pretty hurt. I don't know if I laughed in her face, but I know that I'm petite. I'm only 80 pounds. I'm 5 foot. I've always been very small. I come from a small family with small people, so I was shocked, to say the least. And I told her, no, I don't. And she said, well, how many meals a day do you eat? And I told her 3, even though sometimes I do skip lunch. And then she asked me, how many calories do you intake in a day? I mean, she just kept pressing the issue. And at that point, Cody had stepped in and said, I cook for her and she eats. And she kind of laughed it off and was like, oh, is he a good cook? And, at that point, I just wanted to go into my shell and just literally cry. So she tried to do the exam, unsuccessful, shocking. And she was like, well, I don't know how I'm going to be able to diagnose what's going on. So I said, well, I can take the Q-tip and try to get it in as far as I can and see if we can get a sample on there. And she's like, well, you can try, but I don't think you'll get enough to yield me a result. But we can try it. So I did that, and then I left. And I did get a positive for yeast. So I was able to get enough on there. And she prescribed me this pill, and I had a refill, so I took it, right after I seen her, and then my symptoms were 100% gone, so I had to take one more, and then it was clear. So fluconazole is the only way to really do it if you can't use the over-the-counter creams for a yeast infection. Bacterial vaginosis treatment is antibiotics. There have been people that use boric acid or other things, home remedies, but I've had bacterial vaginosis and I used antibiotics and it cleared it up. So the midwife situation, OBGYNs, we have to start changing our mind frame. I think a lot of times when you go to a physician and you're supposed to trust their opinion, we tend to be yes patients. We tend to agree. We tend to not share our opinion or our reservations if we have any, if we're not comfortable. And it's important to voice to your physician if you're not comfortable with something. And we have to also change the mind frame as in they work for us. If you're getting married and your wedding planner isn't doing their job, you're going to fire them, right? Your physician should not be an exception to the rule. In fact, they should be held at a higher standard for your health and your safety. And they should be someone that you're comfortable talking with. So I hope that you enjoyed this video today. I hope I was able to give you some insight. And the next video I have is going to be on mental health and sexual dysfunction and how they can influence each other. So I will see you sometime next week. As always, you can reach me by email if you have any questions, concerns, etc. So I will see you guys next time.